I am an assistant professor in the Department of Plastic Surgery, सुकटन शल्यशास्त्र. तर तुमच्यामध्ये राहून मला खूपच बरं वाटतं, एवढे सेवाभावी लोकांमध्ये. पहिल्यांदा तुमच्यासाठी टाळ्या की तुम्ही एवढं छान काम करताय, सेवाभावाने काम करतात आणि स्वार्थाशिवाय काम करताय. तर हे सगळ्यात महत्वाचं. आणि होपफुली माइन इज द लास्ट लेक्चर, सो लाईक महेंद्र सिंग धोनी, आय होप आय एम अ गुड फिनिशर. सो we'll begin with our presentation on the skills done. So first of all, we need to know how is a surgeon trained in our country. So in first MBBS there is an anatomical dissection. It is general, it is not clinically oriented. एका दिशाहीन माणसासारखं ते डिसेक्शन होतं, पण it is with the goal of understanding the basic structure and its relation to other organs. नंतर मग ऍडमिशन होतं पीजी मध्ये, पोस्ट ग्रॅज्युएशन मध्ये. 5.5 वर्षाचं MBBS झाल्यानंतर पीजी मध्ये ऍडमिशन होतं. ऍडमिशन झाल्यानंतर मग पहिल्या वर्षी MS मध्ये असिस्टन्स थ्रू लर्निंग असतं. And when this person goes to the second year MS, then they gradually start performing surgery with the senior surgeon assisting them. Later on, in second year MS, again we saw that they gradually start performing cases. In third year, they start doing independent surgery, but at the same time, the senior surgeon is there behind the shoulder. जर त्या senior surgeon ला वाटलं की काहीतरी maybe it is not going right, or that at that point of time it is identified, and then at the same time he intervenes, he gets washed up, and then the surgery is completed in a safe manner. And that is how training happens. But in certain advanced surgeries, even MS is not enough. So these surgeries are learned later in a similar manner after they finish their training. So what is the need for the state of the art cadaveric lab? तर आता आपण पाहिलं की बरेचसे असे सर्जरीज असतात जे ऍडव्हान्स होतात. त्यांचं ट्रेनिंग झाल्यानंतर परत त्या सर्जरीज इन्व्हेंट होतात, आणि मग नंतर टू लर्न दो सर्जरीज इट बिकम्स व्हेरी डिफिकल्ट फॉर देम टू लर्न इट. आता आय एम रायटिंग अ चॅप्टर ऑन अ व्हेरी सिनियर सर्जन हु इज अ क्रेनियोफेशियल सर्जन. तर इंटरव्ह्यू करताना मला ना बऱ्याचशा अशा गोष्टी माहिती पडल्या. एक सर्जरी ऍडव्हान्स करायला अगोदर जेव्हा त्यांनी 1990s मध्ये ती सर्जरी इजाद केली होती, तेव्हा त्यांना 8 ते 9 तास लागायचे. आणि लहान मुलांवरती ज्यांचे स्कल डिफॉर्मिटीज असायचे त्यांच्यावरती सर्जरीज करायचे. आता ओव्हर अ पिरियड ऑफ 30 years ऑफ ट्रेनिंग, नाव दे आर एबल टू परफॉर्म दॅट सर्जरी अंडर 2 hours. सो तुम्ही बघितला तो लर्निंग कर्व केवढा मोठा होता, दीर्घकालीन होता. 30 वर्ष लागली एका सर्जरीला परफेक्ट करण्यासाठी. सो ह्या लर्निंग कर्व केवढा प्रोलॉंग्ड आहे हा तुम्ही पाहिला. आणि आता कसं आहे, सरकारला डॉक्टर्स प्रोड्यूस करायचे. एका वेळी ऍडमिशन्स आता वाढले, प्रत्येक वर्षी ऍडमिशन्स वाढल्यामुळे ऑपरेटिव्ह चान्सेस कमी होत आहेत. आणि ऑपॉर्च्युनिटी पाहिजे, जसे सर म्हणाले होते, टिश्यूजचा फील घेण्यासाठी. बऱ्याचशा अशा गोष्टी असतात ज्या ठीक आहे बोलल्याने शिकवल्या जातात, पण बऱ्याचशा गोष्टी असतात जे तुम्ही फीलने शिकता आणि ते बोलून शिकवलं जात नाहीत. So there is a need to hone motor skills in depth and understand the nuances of tissues in operations that cannot be taught by another person. तर कॅडावर्स हा शब्द जुन्या काळी वापरला जायचा, बट आता प्रचलित टर्म आहे ह्युमन अनॅटॉमिकल रिमेन्स. बट नाव वी बेग टू डिफर. वी लाईक टू कॉल देम ह्युमन अनॅटॉमिकल गिफ्ट्स, because they are gifts in nature. महर्षी सुश्रुत यांनी 6व्या शताब्दी इसवी मध्ये ऑपरेशन्स करण्यासाठी दुधी, डेड ॲनिमल्स नाहीतर मग कॅडावर्स ह्यांच्यावर प्रॅक्टिस करणं सुरू केलं होतं. गंगे घाटावरती वाहून गेलेले जे प्रेत असायचे ते त्यांचे स्टुडंट्स उचलत असत आणि मग नंतर त्याच्यावर प्रॅक्टिस करत असत. तर तेव्हा पण आता त्यांना एक वाटलं असेल ना की आता मृत शरीरावर कसं ते प्रॅक्टिस करतील. सो ही यूज्ड टू थिंक आफ्टर द सोल डिपार्ट्स द ह्युमन रिमेन्स लूज देअर स्पिरिच्युअल अँड टेम्पोरल रेलेव्हन्स. त्यांचा धार्मिक आणि अस्तित्वावरचा रेलेव्हन्स गेला असून ऑपरेशन्स ऑन दीज कॅडावर्स विल नॉट बी कन्सिडर सॅक्रिलेजिस, तो अधर्म म्हणून मानला जात नाही. आणि ही ऑल्सो सेड दॅट पण हे जे ज्या शरीरामध्ये एका वेळी आत्मा होती त्याच्यावरती सर्जरी करताना त्याला रिस्पेक्टनी ट्रीट करावं, एवढीच त्यांची अट असत. तर ते म्हणायचे तस्मात् कौशल्यम अन्विच्छेदनम शस्त्रक्षारणी कर्मसु यस्य यत्र साधर्म्यम यत्र योगा समाचरे. मला संस्कृत येत नाही हे तर आता कळलंच असेल, पण माझा प्रयत्न. An intelligent physician who has tried his practice hand in surgery of cadavers and on such articles which are akin to body parts, similar to body parts. जसं गोल्ड आहे, that is the दुधीला स्किन ग्राफ्टिंग जसं आपण अगोदर बघितलं होतं ते प्रॅक्टिस करता येतं. Will never lose his presence of mind in professional practice. So the surgical skills lab was started as a joint venture between the Department of Anatomy and Department of Plastic and Reconstructive Surgery. So this inauguration was done, it was first conceptualized by our erstwhile past professor and head of department, Dr. Amresh Baliyar Singh. And it was originally inaugurated on 13th of October by esteemed Dr. Mahalakshmi Wala, who was the first head of the department way back in 1960s. And Dr. J.N. Sinha, who was the past HOD of BHU Varanasi, and erstwhile Dean Dr. Sanjay Oak. And the first cadaveric demonstration was conducted by Dr. Vishweshwar Bhattacharya sir. So it started with a single room, which was previously the CT scan room. Slowly additional rooms were acquired in 2019 to have an air-conditioned demonstration room, operation room, the faculty room, classroom with seating capacity of up to 50 students with audio-visual system and speakers, and separate changing room for males and females with 2 bathrooms. This is the overlay of the facility overview, but let me take you for a tour of it. So right here, situated in Mumbai Central, is the clinical skills lab. It is very important for us to understand the need to seed the skills, get a feel of the tissues. Because surgery is an art. आणि प्लास्टिक सर्जरीमध्ये एक मायक्रो सर्जरी नावाचं एक सर्जरी असते, ज्याच्यामध्ये जे टाके असतात ते ह्युमन हेअर पेक्षा पण बारीक असतात. सिमिलरली ऑफ्थॅल्मॉलॉजीमध्ये पण सिमिलर टाके वापरले जातात. सो ही मुवमेंट शिकणं अत्यंत डिफिकल्ट असते आणि ते टिश्यूजवर शिकणं तर अजून पण जास्त डिफिकल्ट असतं, कारण टिश्यूज पण तेवढेच पातळ असतात. ठीक आहे. So the best preparation for tomorrow is doing your best today, and that too in a risk-free manner. So our motto is to build a world-class clinical skills laboratory, to provide training to excellent doctors, to provide quality services which will in turn provide service to a larger population. And our mission is to train and research to serve better. It was done with the help of Gulab Chand Foundation, which was HCC, and now today we have expanded to a 3,000 square foot facility with all the necessary things. So we saw that there is a dissection hall with 6 tables, demonstration room, cadaver preservation room, which is a deep freezer that we'll see later. So this is the lecture hall with a seating capacity of 50 people. This is the operation hall with 6 tables, and it is exactly like like you will have it in an operation theater, wherein these are the tables that are used that are used in the operation theatre as well. There are OT lights that you can see. So you give them a feel of performing a surgery live, and that too in a risk-free manner. And this is the cold storage room wherein the bodies are stored at -20 degree. तिकडे मग त्याचं डिकम्पोजिशन होत नाही, पण ते हार्ड होतात. मग त्याला परत नॉर्मल सॉफ्ट करण्यासाठी त्याला थॉ केलं जातं. त्याला एका वेगळ्या फ्रीझरमध्ये आणलं जातं +4 डिग्री सेंटीग्रेडमध्ये, आणि मग ऑन द डे ऑफ द सर्जरीज they are brought out and then surgeries are performed on them. There were numerous challenges that we faced in creating the SSL. A lot of them, but administration has helped us a lot. There has been a very strong support by the administration, and Dr. Shailesh Mohite, our dean, has facilitated every civil and other work whenever the need arose. And of course, the backbone of the entire project is the Department of Anatomy, and we'd like to acknowledge the work done by late Professor Shyam Kishore sir and our current HOD Dr. Yuvraj Bhosle sir. तर मग हा कोर्स कंडक्ट कसा केला जातो, तर all ethical and legal guidelines are strictly followed. It is a workshop that is open to other institutes also. हे फक्त नायरच्या स्टुडंटसाठी नाही, तर देशभरात आणि इंटरनॅशनली बाकीच्या पण स्टुडंटसाठी आहे. हे फक्त एका रजिस्टर्ड एज्युकेशनल इन्स्टिट्यूट नाहीतर बोनाफाईड बॉडी विच इज रिकॉग्नाइज्ड बाय द महाराष्ट्र मेडिकल काउन्सिल यांच्यातर्फे केलं जाऊ शकतं. Only charges that are levied on these organizations are the facility charges. The cadavers are not charged. It is a no-profit scheme, and it is one of the first facilities in India. It provides a learning opportunity at a subsidized cost, and that way it becomes accessible to many. आता परदेशात तुम्ही हे cadavers course साठी register केला, you are paying 20 times the amount that you are paying here. So they are, as I told you, they are stored in cold storage at -20, and 24 hours prior they are brought into a 4 degrees freezer. They are thawed, and this ensures that crystal formation, the ice formation, is removed, and there is a proper tissue feel that you get in a normal body. And since our cadavers are obtained solely through donations which are facilitated by y'all, we feel respect to the deceased is of utmost importance. A pledge of respect is recited prior to every program with a 2-minute silence as a mark of respect. We also ensure that to restrict dissection only to the relevant areas. डोळ्याचं ऑपरेशन शिकायचं तर फक्त डोळ्याच्या अवतीभवतीच त्यांचं डिसेक्शन लिमिटेड राहील. ते पायाचं डिसेक्शन त्यावेळी करू शकणार नाही. अँड ऑल कॅडवर्स आर प्रॉपरली सुचर्ड. त्यांना व्यवस्थित टाके घेऊन कम्प्लीट क्लोजर केलं जातं, आणि इन दी एंड दे आर होल अगेन. त्यांचे पार्ट्स काढून आपण हे नाही करत, त्याला वेगळं नाही करत. आणि जनरल फोटोग्राफी अँड व्हिडिओग्राफी इज नॉट परमिसिबल अनलेस इट इज ऑथराइज्ड. And every part of the body that is operated on, the bodies are carefully transported back into the deep freezer, and they are used throughout the year till all the parts are dissected, or rather all the parts are operated upon. Registration delegates are usually distributed in a group of 2 or 4. The senior faculty demonstrates the operation in the demonstration room. ते बसून सगळे बघतात. त्या demonstration room में वो सारे students जो है पहले सीखते हैं, and at the end of it वो अपने ऑपरेशंस परफॉर्म करते हैं, और वहाँ पर एक रजिस्टर्ड फैकल्टी और एक होते हैं, दोज हु गाइड देम फॉर सर्जरी, लाइक वी डू इट इन अ लाइफ सर्जरी एज वेल. We have conducted many such workshops wherein eminent national and international doctors have come to train our Indian doctors, and again in 2019 the expansion was inaugurated by Honorable Chief Minister Shri Uddhav Thackeray ji. But again, since from 2020 to 2022, we lost our valuable time because of COVID. But again, those resources were properly directed towards the COVID efforts. Then the first facial dissection and rhinoplasty course was conducted by the Department of Plastic Surgery on 26 January 2023. And as the word spread, various specialties from different institutions and educational bodies wanted to conduct their workshops. So over a period of 3 years, between 2023 and 2025, we have held around 79 training programs, and 2034 registered delegates, doctors, were involved in our programs. So total 2034 लोकांनी याचा लाभ घेतला आहे डॉक्टर्सने. And these programs were conducted for multiple surgical, but also for medical disciplines. बरेचसे प्रोग्राम्स आम्ही कंडक्ट केले, आणि इयर ऑन इयर तुम्ही पाहाल की पहिल्या 2023 मध्ये आम्ही 22 प्रोग्राम्स केले. 24 मध्ये we did around 28 programs and in 2025 we have done 29. So almost every alternate week the cadaveric lab or the surgical skills lab is being utilized. You can see that around 55% residents have benefited out of this, but most importantly you can also see that 35% post-qualified trainees and 10% senior doctors. So 45% after their training. So you can see how this lab is being utilized even after the training is completed, so that they can update themselves. When compared to other modalities of learning, cadaveric training programs were far superior. And 92% of all the delegates that we have talked to have told us that the cadaveric dissection had a high impact on their surgical learning. So our parting thoughts are that anatomy is the lifeline of surgery. Anatomical dissection हे फक्त पहिल्या वर्ष MBBS चं काम नव्हे, तर हे एक lifelong learning आहे. Basic and complex surgical skills are developed easily with a cadaveric practice. Only a handful of centers are present in India that have dedicated cadaver labs, and surgical training today is heavily dependent directly patient-based method. Setting up this facility has had its challenge for us. हे काही एका दिवसाचं काम नव्हतं, ही एक 10 वर्षाची एक तपश्चर्या होती. तर कॅडाव्हर प्रोक्युअरमेंट, एथिकल, लीगल चॅलेंजेस मध्ये तर आपल्या अनॅटॉमी डिपार्टमेंटचा आपला मोठा सिंहाचा वाटा होताच. And also running such centers requires dedicated manpower. So I'd like to thank our department residents, past, present, and obviously future, who are going to carry forward this legacy. And our facility is a public initiative and offered at a very subsidized cost. It is still evolving as time progresses. And it is basically a teamwork, a very well-oiled machine between the administration, the Department of Plastic Surgery and the Department of Anatomy. So what the future holds? Having state-of-the-art microscopes, smart classrooms, improved audiovisual systems, high-powered drill bone systems, dye techniques to highlight the vascular anatomy, heavy equipment like CIAM, robotic, endoscopic units, and having more advanced versions of cadaver preservation in the form of half embalming techniques and freeze techniques to improve the tissue feel. At the heart of it, respect always comes before learning. Thank you very much.
अशा किती लॅब्स आहेत इंडियामध्ये?
इंडियामध्ये सध्या पहिली जी झाली ती आपल्याकडे झाली. त्यानंतर मग प्रायव्हेट मेडिकल कॉलेजमध्ये रमायामध्ये झाली. आणि नाव देयर इज अनदर लॅब ॲट एम्स दिल्ली. But ours is the only fully functioning government municipal lab.
Symbiosis is Pune also.
Symbiosis is Pune, but again private is
Private.
No, the cost for a delegate, routine cost that we inquired, in Bangalore or in AIIMS Delhi, so or in Symbiosis, generally a delegate has to pay around 75,000 to 1 lakh for registration. Okay. Of course, we charge only the running costs. Okay. So in our this thing, it could be anything between 10,000 to 20,000.
Okay, and what is the duration?
Duration is 1 day.
Okay.
It cannot be extended because the cadaver has to go back. The cadaver is first thought, used for 24 hours at room temperature. You can't keep it for room temperature for a longer duration.
Correct.
जास्त वेळ आपण बाहेर ठेवू शकत नाही. So it has to go back next day. So the duration is only 1 day.
Okay, so every time
If we have to conduct it for 2 days, that is possible. But we have to use different cadavers.
Okay.
Same cadaver cannot be used, so we use another set of cadavers. Thirdly, we don't call it a cadaver as you have said. And secondly, these are not charged. The donation, somebody has given a donation and that is absolutely free.
correct.
So what we charge is the facility charges. It is not a cadaver charge. Okay, so the facility that we provide, and if you notice that each station is just like an operation room. म्हणजे तिथे ऑपरेशन टेबल आहे, त्या टेबलवर तुम्ही जी आपल्याला पोझिशन द्यायची, प्रत्येक ऑपरेशनची वेगळी पोझिशन असते पेशंटला. कधी सिटिंग पोझिशन असते, कधी अपसाइड डाऊन, वेगवेगळे पोझिशन्स असतात. सो यू कॅन गिव्ह व्हेरियस पोझिशन्स. इट इज जस्ट लाईक एनी अदर ऑपरेशन टेबल. ऑपरेशन लाईट्स असतात, सक्शन मशीन्स, कॉटरी मशीन्स. Okay, OT, everybody has to change in the OT this thing. So it is just like simulation of ऑपरेशन थिएटर. जसं ऑपरेशन थिएटर मध्ये तुम्ही करता तसंच इथे करायचं आणि जे करतो आपण ते डिसेक्शन नाही. यू जस्ट कांट जस्ट गो अँड कट द ट्रीज ॲट रॅन्डम. यू हॅव टू ॲक्च्युअली परफॉर्म द ऑपरेशन. नुसतं बॉडी जाऊन डिसाइड करून उघडून बघूया असं नाही. खोल के देखते हैं कैसा है, ऐसा नहीं है. You have to perform the operation that you are going to perform in live. Same steps, one by one you have to do. And first, of course, that is guided by some faculty. That is transmitted live to the operation room. एक ती faculty room आहे बघा. तिथं ते demonstration होतं. So first 1 hour is demonstration of that operation, which everybody looks. That is stored. So you can at each table, no, there is a screen. So you can watch it again when you are actually performing the operation, the delegates. And at each table, again, there is a guidance provided. So, एक कोणतरी senior surgeon त्यांना मदत करायला असतो. प्रत्येक टेबलला एक. So, असे 7 जण असतात. So, that is how it is conducted.
Sir,
And, yes, sir, yes, sir.
I thought do you have any plans to go for soft embalming?
Yes, sir, yes, sir. सॉफ्ट एम्बॉलमचा ना तसा बेसिक बेनिफिट नाहीये. त्याचा बेसिक यू कॅन प्रिझर्व देम फॉर अ लॉंगर ड्युरेशन, दॅट इज ओके. बट विथ स्टोरेज ॲट -20,
That is more.
हां, विथ स्टोरेज -20, सॉफ्ट एम्बॉलम त्याचे पण काही दोष आहेत ना, असं नाही. आवर बॉडीज कॅन बी प्रिझर्व फॉर 1 year. ओके, सो इफ यू प्रिझर्व द बॉडी फॉर 1 year, you can use it for 10-15 different operations.
Without embalming?
Without embalming. Okay, we plan to embalm also. We'll see how it goes because everything comes at a cost. Embalming fluid ते मद्रासून मागवायचं, तिकडनं मागवायचं. Nobody wants to share the formula. त्याचा नेमका फॉर्म्युला काय कोणच माहित नाही. And other thing is ते vascular काय म्हणतात इंजेक्शन टेक्निक. So you inject some dye in the vessels. So they are आपल्या रक्तवाहिनी असतात. अपने जो blood vessels है उसमें dye inject करके वो जो blood vessels है अच्छे दिखते हैं. So that dye injection technique is supposed to be a good tool for learning. So that we will be doing.
So this dye that sir talked about is a latex dye. मग बेसिकली काय आहे की ते जसं आपण नॉर्मल इंजेक्शन करतो तसंच असतं, बट आफ्टर अ पॉइंट ऑफ टाइम इट सॉलिडिफाईज. अँड स्टडी ऑफ सच वॅस्क्युलर स्ट्रक्चर्स हेल्प्स अस आयडेंटिफाय द डिफरंट वॅस्क्युलर पॅटर्न्स. आणि कुठली पण 2 बॉडी सेम नसतात, पण पॅटर्न सिमिलर असतात. सो हे पॅटर्न समजल्यामुळे ऑपरेशनची ड्युरेशन कमी होते. आणि सॉफ्ट एम्बार्मिंग टेक्निक्स, आपण जे एम्बार्मिंग टेक्निक्स आता फ्युचर होल्ड्स मध्ये सांगितलं. सो दीज आर टू इम्प्रूव्ह द कंडिशन ऑफ सर्टन टिश्यूज लाईक नर्व्स. तर ते नर्व्स ओव्हर अ पिरियड ऑफ टाइम डिसइंटिग्रेट होतात, पण सॉफ्ट अशा काही एम्बार्मिंग टेक्निक्स आहेत त्याच्यामुळे नर्व्स ओव्हर अ पिरियड ऑफ टाइम स्टेबल राहतात आणि ते नर्व्हचे स्ट्रक्चरचे डिसेक्शन इम्प्रूव्ह होतं. तर दॅट इज द ॲडव्हान्टेज ऑफ एम्बार्मिंग टेक्निक्स.
So we will be using it. Soft embalming, it is not out.
For emergency,
Yes.
those student na त्रास
That is,
होतो ना,
yeah.
that can be avoided.
Yes, yes. We are doing that. As of now, we are concentrating on injections.
Sir.
कारण काय सर, प्रत्येक गोष्टीला ना शेवटी पैसा लागतो. To procure this dye also, no? Where I will get the money from? I can't charge the students. से ते 10,000 चे 15,000 केले, अरे 15,000 हो गया. तसं नाही.
So basically skills lab
Yes.
हा उपक्रम, this is a very nice facility but it's very expensive. From our end we have to spend a lot. Another issue I'll just tell you, because every day there are no workshops, so we cannot have a permanent staff over there. You know, workshops will happen 5 days in a month, sometimes 15 days in a month. So now we need to get people to take the body out because there is no permanent staff. So त्यासाठी मग ते वेगळी लोक बाहेरून बोलवायला लागतात. So it's a challenging